Good evening.
Good evening.
My name is Jessica. I'm going to be your nurse today doing your assessment. Can I have your name?
Christopher Simmons.
Hello, Christopher. What is your date of birth?
August 2nd, 1987.
All right. It's nice to meet you. Today we're going to be assessing your cranial nerves, your reflexes, and your musculoskeletal system.
Wonderful.
Perfect.
Can't wait.
So, for your first cranial nerve, which is your olfactory nerve, I would like you to close your eyes and occlude one nostril. And I'm going to give you something that I'd like you to smell, and I want you to tell me what it is.
That's a cookie.
Okay, go ahead and block the other side.
That is a White House blueberry donut candle.
It is for our friends viewing. All right, so next we're going to assess your optic nerve. So I want you to go ahead and stand up. Look at me. Okay, go ahead and cover one of your eyes. I'm going to cover my opposite eye. I want you to look at this one and tell me what numbers I'm holding up.
1, 3, 5.
Okay, we're going to go ahead and do the other side.
2, 3, 4.
Perfect. Okay. All right. So then we're going to go ahead and do our Snellen chart, which is right over there. And if you could read me the lowest line that you can see clearly, or that you can see.
EDFCEF.
That was very close. EDFCZP. I guess we're not 2020.
Apparently not.
Okay. So for our third, it's going to be our ocular motor. And I still want you to stand in front of me. And I'm going to do your 6 cardinal gaze fields, which we have done in a previous video. So I want you to look at my pen, and I want you to only follow it with your eyes. Perfect. All right. So that covers your ocular motor, trochlear, and abducens cranial nerves, which is 3, 4, and 6. So then also I'm going to make sure that your pupils are equal, round, reactive to light. So just go ahead and look at me. Okay. All right. So pupils are equal, round, and reactive to light in both eyes. All right. So if you want to go ahead and sit down. For our 5th cranial nerve, this is our trigeminal nerve, so we're going to check the motor. So I want you to bite down and check your masseter muscles. And then I'm going to put my hand underneath your chin, and I want you to try to open your mouth. Good. So sensory. Okay, so for the sensory of our trigeminal nerve, I'm going to touch you with a sharp and dull object on your face, and I want you to be able to tell me if it is sharp or dull. So if you could close your eyes.
Don't cut me.
Okay. Is that sharp or dull?
Sharp. Dull. Dull.
Good.
Sharp.
All right. So for our seventh cranial nerve, which is our facial, I want you to close your eyes tight, open them wide. Good. Smile, frown, puff out your cheeks. Perfect. All right. Cranial nerve 8, which is your vestibular cochlear. This is going to be the whisper test. So I want you to occlude one of your ears, and I want you to tell me what I've whispered to you.
Hello.
Next ear.
Summertime.
Okay. We also have done the Weber and Renee test. For cranial nerve number 9, which is your glossopharyngeal, I want you to say ah, and I'm going to watch your uvula go up.
Ah.
I'm going to use my pen light.
That would be a wise idea.
It would.
Ah.
Perfect. And would you say that your gag reflex is intact?
Yeah.
Okay. All right. So cranial nerve 10, which is your vagus nerve, we've already seen that he can speak without hoarseness, and I'm going to ask you to swallow. Good. Swallowing is present and symmetric. All right, cranial nerve 11, which is accessory. So I want you to go ahead and rotate your head from side to side, but I want you to do it against resistance. Good. Perfect. And then I want you to lift your shoulders. Good. All right, and then the last one, your cranial nerve 12 is your hypoglossal. I want you to stick your tongue out, move it from side to side, up and down, and put it in and push your cheeks. Perfect. So that concludes our cranial nerve assessment, which you have just done perfectly.
Wonderful.
Next, we are going to do our cerebellar assessment. So this is evaluating the coordination and fine motor skills. So this is rapid alternating movements. I want you to put your hands on your thighs, and I want you to rotate them quickly. Good. Okay. I want you to put your finger to your nose and touch my finger. Nope, the other finger. Good. 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 All right. If you would stand, please.
Ugh.
Over there. And I want you to walk heel to toe. Good. If you could turn around for me and walk normal. Perfect. So our gait is good. We're not swaying from side to side. And then go ahead and sit down. I want you to, with one foot, put your heel to your shin and slide up and down your leg. Good. And then the other side. Perfect. All right, so our cerebellar is intact. Next, we are going to do proprioception. So this is your ability to sense your body in space. So the Romberg test, I want you to go ahead and stand up. Your feet hip width apart. Cross your arms on your chest like so. Okay. And then I want you to stand there for 30 seconds. Without swaying. You have 9 more seconds. 5 more seconds. Okay. I want you to stay as you are and close your eyes. And just stand. Almost there. Good. All right, so the patient was able to stand without any swaying. So then we are going to do that sharp and dull object again. So you can go ahead and sit. I want you to close your eyes and I want you to tell me where I'm touching you and if it is sharp or dull.
Shoulder, sharp. Elbow, dull. Wrist, sharp. Thigh, dull.
Mm-hmm.
Knee, sharp. Shin, and it felt sharp.
Mm-hmm.
Shoulder, dull. Elbow, sharp. Hand, dull. Knee, dull. Ankle, sharp.
Okay, perfect. All right, so this next test is stereogenesis. So I am going to give you a familiar object in one hand, and I want you to identify it with your eyes closed.
This feels like a pen light.
Okay, and then your other hand.
This feels like a White House blueberry donut candle.
Perfect. All right, next we're going to do, this is the 2-point test where you're going to tell me if I'm touching you with one object or 2 objects with your eyes closed.
1. 1. 2. 2.
Mm-hmm.
1. 1. 2.
Good. Okay, and then next, I would like you to give me your hand. Close your eyes, and I want you to tell me the letter that I'm drawing.
V. T.
T. Tell me the number.
3.
Perfect. Okay, and then we're going to, I'm going to move your finger. I want you to tell me which way it's moving.
Up. Down. Up. Down.
Your other hand.
Up. Down. Down. Up.
Okay, so we're going to go ahead to our deep tendon reflexes. We're going to assess our brachioradialis. This is 1 to 2 inches above the wrist. Okay. And then our bicep tendon. So we are assessing muscle movement and finger movement. Tricep tendon, we're going to bend the arm at 90 degrees. Good. And we're going to go ahead to the other arm and do the same. And the arm. Don't do that. Good. Okay, so our next one is patellar. So if you could sit back, relax. Relax. I guess that's just okay. Hold on. Good. Next one. Good. Okay. Next, we're going to do the Achilles tendon. So if you could give me this foot, relax. Okay. Relax. Okay. And then the plantar. So we're going to stroke the lateral side of the foot and then across the balls of the feet. Okay, so then we're going to assess for clonus. So we're going to dorsiflex the foot rapidly and then stop, force the foot up, and then let go. Relax. Okay, so no clonus is present in the right. There's no clonus present in the left. Lastly, for the deep tendon reflexes, we're going to do a Babinski. Okay. And the toes flexed in, which is a good thing. We don't want the toes to flare out, which is bad. Good. All right. We are now going to move on to our musculoskeletal exam. So we're going to assess all of your joints. So if you want to sit forward for me. Okay, so we're going to go ahead and start with your fingers and your wrist. So I am just inspecting your hands, fingers, wrist. I don't see any swelling, redness in your hands. Do you feel any pain in your hands or wrists when I'm touching, squeezing, any pain or tenderness?
No.
Good. Okay, so with the fingers and wrist, we can do flexion, extension, and we can go in and out, which is adduction and abduction, right? And we can also do that with our fingers. And you have no pain or tenderness with that.
No.
Great. Okay, so then I'm going to put your hand like this. I want you to put your hand kind of like that, yep. And there is a little depression right between this tendon above the thumb. And I'm going to press here. Is there any pain there?
No.
Good. Any pain there?
No.
Good. Okay, so then we're going to go ahead and assess for carpal tunnel. So I want you to put your wrist like this. Good. Any pain there?
No.
Pain there?
No.
Good. So then you can go into a praying and then push your hands together. Any pain?
No.
And then reverse prayer. Any pain in the inner wrist?
No.
Good. Okay. So then we can do the Finkelstein. You can make a fist and tuck your thumb, right? And then I'm going to extend your wrist down. Any pain there?
No.
Good. And the other side? Good. Okay, and then lastly, we're going to do the Allen test. So I am going to occlude, go ahead and make a fist. I'm going to occlude both arteries. Go ahead and open your hand. Okay, see how it's white?
Uh-huh.
Now let go. Pink.
Yep.
So our ulnar artery is patent. Go ahead and make a fist. Open. Our radial artery is also patent. We're going to go ahead and do that to the other hand. Open. Ulnar, patent. Open. Radial, patent. Very good. You have great arterial flow in your hands.
Wonderful.
All right, so then we're going to go ahead and inspect the elbows. So I know that we have some pain and problems with extension in the right elbow.
Correct.
Okay. So I'm just going to take a look at this elbow. I'm inspecting it. I don't see any redness, no abnormal swelling. So it does not feel abnormal in any way. So I want you to go ahead and so you can flex outwards. Okay, and then inward. Good. And then up and down. So where is your limitation there? Is it on the upward? It looks like that it's not all the way.
There's also sitting back, but no, the limitation would be outward like this.
So flexion. Okay. And then I heard some cracking while you were doing that.
Yeah.
Is there any pain associated with that?
Yeah.
Okay. All right. And then we are looking at the other side. This elbow also appears quite normal, no redness or swelling. And then on palpation feels quite normal. And then if you could go through those motions again. Good. Flexion. Any pain there?
No.
Good. Extension. And yep. And back up. Good. Across the body. Good. All right. And then I want you to put your hands out. So this is pronation, supination, pain. I saw you wince.
Yeah, pain in the right elbow.
In the right elbow. Okay. All right. Thank you. All right. So then we're going to move forward with the shoulders. So I am inspecting the shoulders. They are symmetrical. So we're going to go ahead and start at the substernal notch, which is here. We're going to find both of our clavicles, which I have found both. And we're going to walk my fingers down both clavicles onto the shoulders. Okay. So then that brings us to the acromion process. And then here's the AC joint. So in here, right here, is the deltopectoral groove, and we have that on both sides. And then in here is your bicep groove on both sides. Okay, so range of motion for your shoulders. So we're going to do, you can put your shoulders up, down, okay, so we're going to assess the shoulder by, go ahead and bend your arm, right? And we're just going to rotate the shoulder back. Any pain in the shoulder?
No.
Okay. And do the same this way. Good?
Yeah, no
Okay.
pain.
Now, I want you to do the scratch test. So with your left hand, I want you to scratch the back of your right neck. Good. Other side. Good. Any pain?
No.
Okay. Now I want you to do the same thing, but I want you to go under to your opposite shoulder blade.
No pain.
Okay, so then we're going to go ahead and move on to the spine. So first we're going to inspect the neck. Okay, chin up for me. Good. Neck is symmetrical on both sides. Any pain while I'm pressing?
No.
Good. Okay, so I want you to tuck your chin to your chest. Good. Look up to the ceiling. Turn your head left to right in a normal. Yep. And then I want you to touch your ears to your shoulders. Good. Perfect. All right. So if you can stand for me, and then go ahead and stand to your side. I'm just going to assess your spine. We have a natural curvature, cervical spine up here into our thoracic spine, down into our lumbar spine, which is a bit concave down here, down into our sacrum. Okay. And then could you, yeah. Okay, so I'm gonna palpate down the vertebrae. Any pain
No.
or tenderness while I'm doing this? Good. Okay, so I do not feel any step-offs with any of the vertebrae. I'm going to palpate the muscles for each side. They are symmetrical on both sides. And any pain at all?
No.
Good. So I want you to bend forward and try to touch your toes. Good. So this is checking for any curvature for like scoliosis of the spine. The spine has continued to stay straight, and the shoulders are straight on and not rotated at all. Go ahead and stand. Okay, and then can you bend backwards? Good. Rotate side to side. Good. Any pain?
No.
Good. And then I want you to bend side to side.
Okay.
Perfect. All right. So this is the part where we're going to kind of lay and roll around a little bit. We're going to assess your hips. So if you can go ahead and lay on your back. Good. So I'm just going to palpate the hips here. I want you to lift your right leg. Good. And then while you're on your back, if you can put your leg down and kind of like cross it over your left, but like in the air. Good, good. Okay, and then I want you to do the same with your left. Good. Any pain?
No.
All right, go ahead and go to your side, whichever side you want to start on. And I want you to lift your leg. Good. And then kind of like lift it in the front of you. Good. Perfect. And then I want you to do the same thing on the other side. Good. Okay. All right. And then if you could sit up, we're going to go ahead and inspect the knees. So I see that both knees are, there's no redness, there's no swelling. So we're going to go ahead and palpate the knee around the patella. Any pain on palpation? Good. Same on both sides.
No pain.
Good. And then I want you to flex and extend both of your legs. Well, you don't have to do it at the same time, but yes. And then if you could like bend it back a little bit. Good. And same thing on the other side. Good. So then we're going to adduct and abduct. So you're going to kind of swing your leg out and in, out, in. Good. Other side. In, out. Good. Perfect. Okay. And then the last thing we're going to do is the ankles. So I know that you do have previous fractures of both ankles, correct?
Correct.
Okay. So any pain in the ankle joint?
No.
Any pain on palpation when I'm touching it?
No.
Good. And then if you want to go ahead and do some ankle circles for me. Okay, so there's definitely some creaking and crackling happening in there for sure. On the outer right side of the ankle. So if you want to go ahead, any pain?
No.
Okay, and go ahead and rotate. Okay, so this one is not really cracking at all. Okay. All right. That concludes our very long assessment of your cranial nerves, deep tendon reflexes, cerebellar and proprioception, and your musculoskeletal system.
Wonderful.
Thank you so much for your time.
You're welcome. See you next week.
See you next week.